Today we are going to be looking at interventions to treat unilateral vocal fold paralysis. My name is Jessica.
My name is Emily.
I'm Madeline.
And I'm Madison.
Our goal was to find 3 interventions used to treat unilateral vocal fold paralysis. The reason we wanted to look into this specific disorder was because there's limited research in this area of study. But unilateral vocal fold paralysis can really prevent the person from properly abducting and adducting their vocal folds, which can really prevent them from communicating effectively. Our literature reviews evaluated the outcomes of voice therapy, vocal fold fat implantation, and alternatives to laryngeal surgery. Each of these methods was shown to improve the function of the vocal folds. Some limitations of our studies included limited number of participants, lack of measures in avoiding complications, and need for further research. These methods were shown to improve vocal quality, which will help to improve the patient's overall quality of life.
Because of the increase of unilateral vocal fold paralysis due to aging and comorbidity, expansion of less invasive interventions is necessary for speech-language pathology. A literature review was conducted to evaluate the viability of interventions used for UVFP. This research is necessary to collect more information on the increasing population and to analyze the effectiveness of these interventions in improving vocal quality. The literature reviews will cover interventions that include less invasive surgeries, vocal therapy, and vocal fold fat implantation. This research is important to us as SLPs because even though we cannot make a laryngeal diagnosis, we do work closely with ENTs who are responsible for the diagnosis and intervention that is involved.
Today, I will be going over the first literature review, and it involves the administration of hyaluronic acid through an electroneedle during laryngeal electromyography. Now, an laryngeal electromyography allows the ENT to get a visual of the vocal fold muscles and its electrical activity. The hyaluronic acid prevents dryness of the vocal folds. There were 20 participants involved in this study, and 3 of them ended up dropping out due to unrelated medical circumstances. Now, the majority of these patients reported that their vocal fold functioning improved, but none of them actually fully recovered from unilateral vocal fold paralysis. This study is important because it allows the ENT to get a visual of the status of the vocal fold muscles, but more research is needed of other safe materials that can be administered besides the hyaluronic acid.
Okay, so I had literature review number 2, and this was a study between the outcomes of conventional voice therapy and electrical stimulation supported voice therapy on patients with unilateral vocal cord paralysis. On our poster, you can see a picture of the electrical stimulation machine. It is a non-invasive clinical tool used to increase muscle strength and reduce weakness. So this is why it's being studied on patients with unilateral vocal cord paralysis. In the study, there was a total of 29 people who were randomly selected, and they were divided into 2 groups. The first group consisted of 14 patients who were assigned to conventional voice therapy, and the other 15 patients were assigned with the electrical stimulation supported voice therapy. Each of these individuals were not allowed to have any previous history of therapy, immobility onset more than 6 months before therapy, and the presence of any type of other health condition that would potentially interfere with the study. Group 1 patients received 20-minute therapy sessions twice a week for 6 weeks. They engaged in breathing exercises, phonatory exercises, transferred to connected speech, and hard glottal attacks. Group 2 patients received the electrical stimulation therapy, and the duration was also twice weekly for 20 minutes. Voice function exercises such as abdominal breathing, emission of vowels, syllables, bisyllables, and cough with vowel were conducted while using the electrical stimulation method. And the results found that a significant statistical difference in the auditory perceptual assessment in both groups but no significant evidence was found that made one group better scoring than the other. Both groups also improved significantly with glottal closure, but nobody, again, was able to regain affected vocal fold mobility in either group. There was also statistically significant data between pre and post therapeutic values for the glottal gap index, but again, no group was better scoring than the other. The lowest fundamental frequency was also significantly elevated in group 2, along with the frequency perturbation analysis. And lastly, aerodynamic measures in patients using the electrical stimulation method improved just as much as those using the conventional voice therapy. So in the study, it was concluded that the patients who did use the both electrical stimulation and conventional voice therapy were equally as effective as each other. However, limitations of this study included that there has not been enough research completed to fully know the efficacy and the validity. There was also a low number of participants. If we had maybe a little bit more of a bigger group, we would know a little bit more about the efficacy of this research. So with that said, further research must be conducted, but from these results, electrical stimulation and conventional voice therapy are equally as effective.
I will be discussing literature review number 3, and this review evaluated the use of vocal fold fat augmentation in the ability to treat unilateral vocal fold paralysis. There was a total of 22 participants, and 11 had atrophy or scar, and the other 11 had the unilateral vocal fold paralysis. The procedures included removing fat from the patient's abdominal wall and using that harvested fat to insert it back into the vocal folds. The purpose of this was to increase glottic closure, reduce air leak, and improve vibratory rates. Stroboscopic analysis showed that the fat implantation improved mucosal wave propagation, face closure, and face 3 years after injection. This shows that vocal fold fat augmentation was shown to be a long-lasting solution to vocal fold insufficiency. Further studies do need to be conducted in order to see how this fat implantation affects the surrounding tissues over time.
The objectives of the 3 articles was to find treatment for unilateral vocal fold paralysis. The methods used were less invasive surgeries, voice therapy, and vocal fold fat implantation in order to improve the outcome of UVFP treatment. The results show that LEMG, CVT, TESVT, and vocal fold fat augmentation are effective treatments for unilateral vocal fold paralysis. The administration of hyaluronic acid enabled researchers to evaluate neuromuscular status of vocal folds without an extra procedure. The study concluded that LEMG has a high positive predictive value in predicting long-term outcomes of UVFP patients who have a poor prognosis. Researchers concluded that CVT and TESVT are both equally effective. The procedure of fat implantation increased mucosal wave propagation, phase closure, and phase symmetry 3 years after injection. Overall, there are a variety of less invasive treatments that can be used for UVFP, as well as allow for improved vocal quality.
Overall, each of these literature reviews showed improvements from the interventions of those who have unilateral vocal fold paralysis. As mentioned, some limitations include participants dropping out of the study, a limited number of participants, and in general, more research is needed. But this research can help inform not only just SLPs, but the unilateral vocal fold paralysis community, and also improve their quality of life. We hope that this poster presentation was informative, and thank you for listening.